Hi dentist, it's P Square. Let's learn pharmacology topic corticosteroids. It is very important because a short note or a 10-mark question comes from this in BDS second year final exam. Corticosteroids are the hormones produced by cortex of adrenal gland. They are glucocorticoids, cortisol, mineralocorticoids, aldosterone, and a small amount of androgens. The secretion of adrenal cortex is under the control of ACTH, which is secreted by anterior pituitary, which in turn is regulated by corticotropin releasing factor. This is termed as hypothalamic pituitary adrenal axis. The normal rate of secretion of two principal corticoids in the man is hydrocortisone 10 to 20 mg daily, and half of which is nearly secreted in few morning hours, and aldosterone 0.125 mg daily. This is the pathway of adrenal steroid hormone biosynthesis. In this, cholesterol is converted in the final as aldosterone, hydrocortisone and testosterone. Actions of corticosteroid. Mineralocorticoid action. इसका मेन एक्शन होता है to reabsorb the sodium ion from distal convoluted tubules in the kidney. It is also associated with increase in potassium ion as well as hydrogen ion excretion. In its deficiency, there is decrease in tubular reabsorption capacity for sodium ion. Glucocorticoid, carbohydrate and protein metabolism. Glucocorticoid इंड्यूस करता है हेपेटिक ग्लाइकोजन सिंथेसिस को, जिस कारण ग्लाइकोजन डेपोजिशन प्रमोट होती है इन लिवर एंड देयर इज प्रमोशन ऑफ ग्लूकोनियोजेनेसिस. कॉर्टिकोइड इनहिबिट करता है ग्लूकोज के यूटिलाइजेशन बाय पेरिफेरल टिश्यू. Along with this, it increases glucose release from the liver, resulting in hyperglycemia and resistance to insulin, and along with it, it produces a state like that of diabetes. They also cause protein breakdown and amino acid metabolization from peripheral tissues, resulting in side effects like muscle wasting, lympholysis, loss of osteoid from the bone, and thinning of skin. Amino acids are utilized by liver in gluconeogenesis, and there is production of excess urea, resulting in negative nitrogen balance. Therefore, it indicates that glucocorticoids are catabolic. These functions are important to maintain blood glucose level during starvation so that brain continues to get its nutrition. Fat metabolism. Corticosteroid promotes lipolysis, but different fat deposits react differently, and there is redistribution of body fat from the subcutaneous tissue over the extremities to its deposit over the face, neck and the shoulder, giving rise to the characteristic moon face, fish mouth, buffalo hump. Calcium metabolism. They inhibit intestinal absorption and enhances renal excretion of calcium ions. There is loss of osteoid indirectly, which contribute to loss of calcium ion from the bone, producing osteoporosis. The spongy bones like vertebrae, ribs are more sensitive. Water excretion. Glucocorticoid but not aldosterone maintain GFR and help excreting excess water overload. Cardiovascular system. They play a permissive role in development of hypertension. Aldosterone insufficiency is attended by low cardiac output, arteriolar dilatation, poor response to adrenaline and increased permeability of capillaries. Optimum level of corticosteroid is needed for normal muscular function, and there is weakness in both hypo as well as hypercorticism. CNS. Mild euphoria is quite common with supraphysiological doses of corticosteroid. This sometimes progresses to insomnia, anxiety or depression as a side effect of corticosteroid therapy. Stomach. They increases gastric acid and pepsin secretion, which may result into aggravate peptic ulcer. Lymphoid tissue. Glucocorticoids enhance the rate of destruction of lymphoid cells. T cells are more sensitive than that of B cells, and there is high rate of destruction by malignant lymphatic cell. Therefore, corticosteroid is used in malignant lymphoid tissues. Inflammatory response is suppressed by glucocorticoid. They are basically suppressed the cardinal signs of inflammation, that are redness, heat, swelling and pain, but they do not remove the cause of inflammation. Immunological and allergic response. Glucocorticoid impairs immunological competence. They cause greater suppression of cell-mediated immunity, which is the basis of use in autoimmune diseases and organ transplantation. Classification of corticosteroid is very important because the question comes as classify corticosteroid and write adverse effect of corticosteroids. Mechanism of action. Steroid hormone enter into the cell. They form a complex with the receptor within the cell, and that is called as steroid receptor complex. That complex enter into the nucleus, which bind to a specific site on the DNA, resulting in protein synthesis, and they show their response. For detailed explanation of mechanism of action along with diagram, click to the right hand corner and watch our video of pharmacodynamics, in which this is explained briefly. Pharmacokinetics. All natural as well as synthetic corticosteroids, except that of DOCA, are absorbed and are effective by oral route. Absorption into the systemic circulation occurs from the topical site of administration as well, but the extent varies depending upon the compound, site, area of application and use of occlusive dressing. Water soluble esters like dexamethasone sodium phosphate can be given intravenously or intramuscularly. They act rapidly and achieve higher concentration in tissue fluids. Synthetic derivatives are more resistant to metabolism and are longer acting. Therapeutic uses of glucocorticoid. Endocrinal uses. They are used to correct the endocrinal disturbances which can be congenital or acquired. Replacement therapy. In case of acute adrenal insufficiency, which is an emergency condition which is precipitated by an infection or sudden withdrawal of steroid. In that case, 100 mg bolus of hydrocortisone hemisuccinate is given immediately. Chronic adrenal insufficiency, also called as Addison's disease. Here, oral hydrocortisone is given along with other corticosteroids. Congenital adrenal hyperplasia, also called as adrenogenital syndrome. It is familial disorder due to genetic deficiency of steroidogenic enzyme, mostly 21 hydroxylase. As a result, the synthesis of hydrocortisone and aldosterone are affected. Non-endocrinal uses. Pharmacotherapy. In case of arthritis, that can be rheumatoid arthritis, osteoarthritis, rheumatic fever and acute gout. It can be used in severe allergic reactions. Corticoids are used for short periods in angioneuritic edema, hay fever, serum sickness, contact dermatitis and anaphylaxis. It is used in bronchial asthma, such as in condition of status asthmaticus. Intravenous hydrocortisone hemisuccinate is given. In case of severe chronic asthma, steroids are used as supportive to bronchodilators. Legend diseases. Polyarthritis rhodosis and other rheumatoid diseases respond to glucocorticoid. Eye diseases. Corticoids are used in large number of inflammatory ocular diseases and they prevent the blindness. They are used in allergic conjunctivitis, optic neuritis and other inflammatory conditions. Renal diseases. Glucocorticoids are first line of drugs in neurotic syndrome. skin diseases like atopic dermatitis, inflammatory dermatosis, and other local conditions are treated with topical steroids. Gastrointestinal diseases, mild inflammatory bowel disease is treated with steroid, and severe cases oral prednisolone may be used. Liver diseases, there is use of steroid in chronic active and alcoholic hepatitis. Hematologic disorder such as autoimmune hemolytic anemia, which is usually respond to glucocorticoid. Cerebral edema, steroid without salt and water retention activity is used, like large doses of dexamethasone is preferred. Lung diseases, corticosteroids are given to treat aspiration pneumonia and prevention of infant respiratory distress syndrome. Organ transplantation for prevention and treatment of graft reaction, as glucocorticoids are immunosuppressive agents. Thyroid storm and to test pituitary adrenal axis function. Adverse effect of glucocorticoid is very important because 100% a short note comes on this, in which you will enumerate each one and you will explain them to get better marks. They are Cushing syndrome, which is characterized by moon phase, buffalo hump, wasting muscle, thinning of limbs and skin, and purpose striae. Hyperglycemia, precipitation of diabetes mellitus. Susceptibility of infection. Long-term therapy with steroid leads to immunosuppression and they increases the chances of opportunistic infections like fungal, virus and bacteria. Mainly the infection comes across is candida. Osteoporosis, especially of vertebrae, is more common in elderly. Avascular necrosis, peptic ulcerations, mental disturbances like euphoria, depression, eye cataract and glaucoma, delayed wound healing. Other effects, raised intracranial pressure, convulsions, hypercoagulability of the blood, allocorticoid effects like salt and water retention resulting into edema, hypokalemia and hypertension. They are rare with selective glucocorticoids. Thinning of muscle due to hypokalemia, hypothalamo pituitary adrenal axis suppression due to long-term steroid therapy. Contraindications, mainly all the side effects they produce are the contraindications such as peptic ulcer, diabetes mellitus, hypertension, viral and fungal infections, tuberculosis and other infections, osteoporosis, herpes simplex keratosis, psychosis, epilepsy, congestive heart failure and renal failure. Mnemonic for steroidal side effect is Hydrocortisone. Mnemonic for steroidal uses is Magic Pearl. Hydrocortisone, cortisol, it acts rapidly but have short duration of action. In addition to primary glucocorticoid, it has significant mineralocorticoid activity. Used for replacement therapy, 20 mg morning and 10 mg afternoon orally. In case of status asthmaticus, acute adrenal insufficiency as 100 mg IV bolus. Prednisolone, a 5 mark short note comes on this. It is 4 times more potent than hydrocortisone and more selective glucocorticoid, but fluid retention occurs with higher doses. It have intermediate duration of action. It cause less pituitary adrenal suppression when single morning dose is given or alternative dose treatment is taken. It is used for allergic, inflammatory, autoimmune diseases and in malignancies. Dexamethasone, very potent and highly selective glucocorticoid. There is no problem of fluid retention and hypertension with it. It is long acting and causes marked pituitary adrenal suppression. It is used for inflammation and allergic conditions. Thanks. Make sure to share the knowledge with your friends. Keep supporting.